Hello, everyone, and welcome. My name is Natasha, and I'm an international student advisor here at Memorial University. My pronouns are she and her, and I'd like to recognize that I'm an uninvited settler here in the ancestral homelands of the Beothuk and the Mi'kmaq. We thank you so much for joining us again for these information sessions held in advance of the start of our winter 2026 semester for those international students that will be joining us in January. So we really look forward to meeting you, and we understand that there's a lot of information that you need to know as you start your studies, before you start your studies. So this session is devoted specifically to talking about health insurance as well as healthcare access while you're here at Memorial University. And I want to begin with a land acknowledgement, and that is to acknowledge that the lands on which Memorial University's campuses are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. And we encourage everyone to reflect on the lands where you're located and the Indigenous people for whom these lands are traditional territory. Canada is a settler colonization, and my ancestors came over as settlers to this land. And you heard me say that at the start when I was introducing myself. And I think it's important to acknowledge, what our place is and our relationship with this land, that we are not the original peoples here in Canada, that those were Indigenous peoples to Canada. And over the course of, Canada's 175 years or so, existence has seen the genocide essentially of different indigenous groups, and so a lot of mistreatment of indigenous peoples who continue to suffer as a result of that colonization. So a land acknowledgement is actually a traditional indigenous practice, but we do it here really as a way to bring that truth that for so many years was not talked about in Canada, as Canada works towards hopefully reconciliation with Indigenous peoples of Canada. So before we begin, I just want to go over a few other things, and that is to say that I'll be presenting a lot of information. I will be stopping in the middle to kind of do a little quiz. I don't have a partner here with me to make it kind of super fun, so I'll try my best. But I think the quizzes are important because it causes us to stop and pause and reflect on what has been discussed so far to see if we are really having that learning. Right? And then afterwards, after we've gone through that presentation, hopefully we then have that basic understanding. We'll open up the floor to questions and answers. So that'll be the Q&A session. All right, so please save it until the end, and we'll do it either through the chat or through the Q&A when that comes by. All right. Now, what is it we're going to be covering in this session? So what is the learning we're going to be looking at in the quiz to make sure that you as a new student coming to Memorial will understand? Well, the first is that you'll be able to talk about the differences between the different types of health insurance that you may be eligible for or that you will have access to as an international student at Memorial. And we'll be talking about foreign health insurance, we'll be talking about MCP, which stands for Medical Care Plan, and we'll be talking about another insurance plan through the student union. All right, so we want you to be able to distinguish what are the differences between those three types of insurances. Second is to be able to discuss, well, am I eligible to opt out of the foreign health? You know, who is eligible to do that? And then thirdly, how do I do that? Fourthly, what is the deadline? Right? So those first four really focuses on our conversation about the differences in the insurances and the practice of opting out. And then we'll talk about your foreign health with GuardMe and what are some services that you can avail of, as well as how do you seek medical care. Okay, so very heavy on the health insurance and then some information about that. Now, health insurance can be a very complicated topic, right? But it is a very important one. Health insurance is something that is used to help cover the cost to seek health care. And it costs money to visit a physician, if you have to make an emergency room visit to the hospital, if you had to have blood work done or a diagnostic test done, like a chest x-ray, for example. If you were written a prescription for medication, you took it to the pharmacy. All of these things cost money. So they're not free, in Canada. There is some level of public health insurance that some of these things can be free if you're eligible, but you have to be eligible and have the health insurance. So health insurance is so important to cover the cost of healthcare. Um, so there are many types of health insurance, which is what really makes it complicated. And also, what also makes it very complicated is that no health insurance is going to cover 100% of everything all the time, right? So in addition to having health insurance, many of us have to be prepared to pay some out-of-pocket expenses for medical care, okay? But hopefully, you know, with at least some of these coverages, you will have the majority, and that's the goal, the majority of your healthcare needs covered. All right. So, as an international student at Memorial University, there are three types of health insurance coverages that you need to be aware of. The first is what is called foreign health insurance, which is the health insurance for all international students at Memorial University. When you are registered as a student and you pay your fees, you'll see a charge for foreign health insurance. The provider of that foreign health insurance is GuardMe. So when we say foreign health, when we say GuardMe, we mean the same thing. The second type of health insurance is Medical Care Plan, or MCP, and this comes from the government of Newfoundland and Labrador. They are the provider of that health care, that insurance. Third are the student union managed health and dental plans. And there are various student unions at Memorial, which student union you are a member of and that you will pay fees to as part of your student charges will depend on your level and or campus of study. Okay, so there's a graduate student union, there's MUNSU for undergrads at the St. John's campus, there's MISU for our diploma students at the Marine Institute, and there's the Grenfell Campus Student Union for our students at the Grenfell campus in Corner Brook. And those student unions all manage a health and dental plan from an insurance company called Green Shield. So if you hear us talk about Green Shield and Student Union Health and Dental Plan, it's the same thing. Okay. So we'll get started to talk about the first one, which is the foreign health insurance. Foreign health insurance is mandatory for all registered international students. It is a health insurance plan that is managed by the Internationalization Office. And in fact, I am the coordinator of that foreign health insurance plan for the Internationalization Office. All right. The current provider of this health insurance plan is a private insurance company called GuardMe. Because the foreign health insurance is mandatory for all registered international students, it will be automatically charged to your student account every semester you are a registered student. So if you have been admitted for the winter semester, your registration period has opened. Perhaps you have registered for your grad program or you've registered for your courses. And when you register, you will see that you're getting charged all kinds of fees. Your tuition is one of them. And you will see the foreign health insurance fee charged to your student account. So once you register, you're charged and we set you up. That's how it becomes mandatory. Now, if there's a semester when you are not a registered student, then it is not mandatory and it is not automatic. Okay. If you attended our information session yesterday for immigration, you know that not being a registered student as an international student can have lots of issues and problems. So of course you want to be aware of those, but if for whatever reason, sometimes things happen, you have to not be a student, just know that that impacts your health insurance too. You don't have health insurance. So you don't want to be in Canada without health insurance. So you would need to take action if you're not registered and purchase, like opt in on your own. But if you are registered, it's just automatically charged and you're set up on that insurance. The current rate for the foreign health insurance is $261 per semester. Okay. And coverage for the foreign health insurance does align with the semester dates. So for the winter 2026 semester, that runs over the course of January to April. So your 261.59 will cover you from January 1 until April 30th in the winter semester. If you're registered in our spring semester, you'll be charged again, and that coverage will go from May 1st to August 31st. And then if you're registered in the fall semester, you'll be charged again, and the coverage will go from September 1 until December 31st. Okay. So you're never, if you're a registered student, without coverage. But it is important to know that as a student arriving in the winter semester, that coverage begins January 1. So if you are arriving earlier than January 1, you don't have any insurance automatically. So you would want to purchase and have insurance to cover you up until that time. And for those of you that have received our welcome email, have been in correspondence with Hareem through the arrivals form, you know that our provider GuardMe has available on their website where you can purchase a daily coverage as an early arrival to cover you up until January 1, right? So what happens with, what does the foreign health insurance cover? So this is another very important piece to be able to distinguish the foreign health, the GuardMe coverage with MCP and the student union plans, the other two that we'll talk about. I describe the foreign health insurance as a comprehensive emergency health insurance, okay, or medical. So we'll take that first word, comprehensive. What I mean by that is there are many different stages you might seek in getting health care if you feel ill. Your first step may be to make a visit, an appointment to visit a physician in their office. There's a cost for that, okay? GuardMe would cover the costs of that doctor's visit. That physician might provide a prescription medication, which you would then take to your pharmacy, which would be a second step in you seeking your health care. And the pharmacist would fill that. GuardMe would cover the cost of that prescription medication, right? It could also be that instead of that route, you are suffering a real, emergency that brings you to the emergency room of the hospital, and that has a cost for that visit. And while you're in the emergency room, you're ordered different diagnostic tests, right? Perhaps you're admitted to the hospital. Maybe you have to have a small procedure, right? And then you're sent home with some prescription medication. So there's different stages that you might go through. GuardMe will cover all of those stages, right? So it is comprehensive in that way. But it will only cover those stages, meaning it would only cover the visit to the physician. It would only cover the emergency room visit. It would only cover the prescription medication in the event of an emergent situation for the most part. An emergent or emergency doesn't have to be so serious as it sounds. What they mean by emergent is something new that requires the immediate relief of pain or suffering. Okay, so basically you have to have symptoms, right, to be able to have coverage for that physician's visit, for that physician to give you medication. There are times when we might want to visit a physician for preventative reasons, right? Or medication we might want to go on that is not needed to treat any symptoms, but we want to look at for preventative means. That's not what this insurance is for. So it is in case you need it for new and emergent situations. It also is primarily a health insurance plan. All right. So there is a distinction between health insurance and dental insurance, right? Um, Meaning that the health insurance is not designed typically to cover you to get a dental cleaning or a dental checkup. Um, the foreign health is the same, although there is emergency dental coverage. So if you have extreme dental pain, if you have a dental accident, so your tooth is chipped, or if you need an emergency like root canal, so a tooth extracted or something, there is some coverage in the foreign health, but it is primarily a health plan, and it's primarily for emergent or new situations. Now, there are aspects to the plan where there is coverage for non-emergent situations, right? And typically they exclude, for example, if you have a pre-existing condition or a chronic health condition where you need medication continuously, because the supply is typically limited to a 60-day supply. However, we do have a benefit added on to our policy where it can cover the visit to the physician, it can cover prescription medication more than 60 days if your pre-existing condition or chronic condition, it, that medication that you're taking is medically necessary, right? So need it for you to live essentially, right? If it's medically necessary, then there is some coverage there. And GuardMe typically will cover up to 100% of an expense, but there's a maximum, right? So over the course of a year, in these medically necessary non-emergent things, it is up to 10,000, right? There is coverage in the foreign health insurance for you to see, for example, a physiotherapist or a chiropractor, those kind of paramedical services. They all have a maximum benefit, okay, and things like that. So it's really important to have an understanding of what your insurance is designed to cover, right? And it is an insurance plan that has been specifically designed for international students. And we've been with GuardMe for a very long time. They provide coverage to students at institutions across the country. Their focus is on international students. That's the population that they serve. So there are benefits in the foreign health insurance plan that is more than just seeing a doctor or medication and things like that, right? There's something called a family transportation benefit. And that's where if you become hospitalized in Canada for a period of at least 7 days, then there can be a benefit your family could have some coverage for a travel to Canada. So their airfare partially or mostly covered, some accommodations partially or mostly covered. There's also a repatriation or burial benefit. So if, the unthinkable happens and you were to die while you were in Canada, there is coverage to send your remains back home, right, for burial. So it's important to understand all the benefits that you get from the foreign health insurance. Okay. All right. So that's the foreign health. Now we're going to get into a second type of health insurance that you might be eligible for as an international student, and that is called Medical Care Plan or MCP. So very different from foreign health. The first major difference here is that MCP comes from the government of Newfoundland and Labrador. So because it comes through the government, we call it a public service, right? It's a public good. Whereas your foreign health with a company called GuardMe is a private insurance. So it's a private company. It's a for profit, industry insurances. Now, MCP is a public good from the government. It's not for profit. There's no cost for it, right? It's a social service or public good that the government provides. Now, MCP is also different in terms of what it covers. It's really been designed to cover kind of your basic healthcare needs, right, as a resident in this province. So it covers the cost to see a medical doctor. So just a physician, not those paramedical services like chiropractor, eye doctor, that sort of thing. It's to see a medical physician. So whether you see that physician in a hospital or in their private clinic, MCP will cover the cost of that appointment. MCP also then would be designed to cover things that are delivered primarily in a hospital setting, right? Now, it's not everything delivered in a hospital, but most surgical procedures, hospital admissions, emergency room visits, and the majority of our diagnostic tests are performed in hospital settings. So like an ultrasound, an x-ray, a CAT scan, an MRI, that sort of thing. Okay. So MCP is really kind of your basic coverage, and it really covers the most frequent reason why one would need to seek health care, right? Or the first step, which is to see a doctor. And then as well, the things that tend to be the most expensive, right? Operating those machines cost a lot of money. So those diagnostic tests, those admissions to hospital, those are all very expensive, but are covered by MCP. So MCP is different because it is a public good from the government. It is free compared to GuardMe or their Foreign Health, which is with a private company and costs you money every semester. It's also different in terms of what it covers. GuardMe covers a lot of things MCP covers plus others, and MCP covers again doctor and hospital. Another major difference with the MCP is that it's not mandatory and it's not automatic, right? You're not going to get MCP automatically by virtue of being registered like you are the foreign health insurance with GuardMe. You have to, first of all, be eligible for MCP, and not all of our international students are eligible for MCP. And second, if you are eligible, you have to make the application. All right. So even if you're eligible, it's not automatically implied. You have to apply and be approved in that application. So to be eligible, you have to be a full-time student. Your study permit has to be valid for at least 1 year, and you have to be a resident of the province of Newfoundland and Labrador. So a resident of Newfoundland and Labrador means you intend to reside and will reside in this province for the majority of the time over the year. So more than 6 months of the year, you will be living here. Your study permit is not issued until you enter and land in Canada. And so that would have to be issued for at least 12 months or 1 year to be eligible. And you have to be not just admitted, but registered as a full-time student. Okay. So if you meet those eligibility, you can be eligible essentially as soon as you arrive here in Newfoundland and Labrador. You don't have to wait till you've lived here for more than 6 months. Once you land, you have the intention to live here for the majority of the next year. You have your study permit for a year. You're registered as a full-time student. Upon arrival, you could be eligible for MCP. So if you are eligible, you're going to apply for MCP. And you will need to complete an application form, and you will need to provide evidence of your eligibility, which would be an enrollment letter issued in the last 30 days that confirms you're a full-time student. So an enrollment letter is not a acceptance letter. You have to show that you're registered then for the winter semester. And you have to give a copy of your study permit and your passport. Okay. So if you are eligible, you're going to make the application. Now, despite the fact that you have the foreign health and that's automatic and it covers many things MCP covers, if you're eligible, you absolutely should apply for MCP. We strongly encourage it, right? You know, MCP will cover you to see a doctor if it's just preventative, whereas the foreign health won't. So it's just an extra layer of protection, which is what insurance really is, right? Helping to insure you and protect you. So you want to apply for MCP if you're eligible, and you can do this through email or by mail to them. And very fortunately, you can do it by visiting the MCP clinic that the Internationalization Office will be hosting on January 7th or January 14th upon arrival, okay? And that information I hope has been communicated to you is on our website, and Harim has organized those sessions, so she can certainly provide you with that information. So if you are eligible, please, please, please apply for MCP. All right. Now, MCP is an insurance that you as an international student might be eligible for, but it is an insurance that our Canadian students, so if you're a Canadian citizen or permanent resident living in the province, you would be eligible for, right? So you'll see your Canadian counterpart students who will have the MCP. And because they have the MCP, they have actually a different health plan through Memorial. And that health plan is a private insurance health plan. So similar to GuardMe, it's a private insurance company for profit. But what is covered by that health plan, that private health plan, is different because one would already have MCP to have this health plan. So this private health plan is designed to supplement or extend those benefits to MCP. So remember, we talked about foreign health being kind of that comprehensive. Basically, foreign health is covering you like MCP in a student union supplemental plan. So our Canadian students who have MCP will automatically get charged a health and dental plan, which actually is managed by their student union. And the provider of the student union plan is Green Shield. Now, the student unions, they separate out the health insurance plan and the dental insurance plan, and there's two different fees for them, right? Um, eh, Both of them are provided by Green Shield. Now, I'm pointing this out because if you're a graduate student coming to study at Memorial, when you look at your student account and everything you're being charged the foreign health, but you'll notice a dental insurance charge. And that dental insurance charge comes through your student union, which is the GSU, the Graduate Student Union. So all grad students who are full-time will have the dental. Now, GSU has a health plan, which is what our Canadian students with MCP have, whereas you have the foreign health. Now, if you get MCP, you might be able to switch to the student union health plan. Okay, you don't have to, but you might be able to. All right. And for our undergrad students, you don't have that dental coverage, but if you get the MCP and switch to the student union plan, you would get their health and their dental, and you'll see them as two separate charges. Okay. Now, it is really important to understand that even though the student union plan with Green Shield is offered through a private insurance company like the foreign health is with GuardMe, the coverages are different. Remember, no insurance is going to cover 100% of everything all the time. The foreign health is primarily, in case you need it or if it's medically necessary. Whereas the student union health and dental plan is not organized that way, right? There's more coverage in terms of prescription medication if it was preventative in nature, right? Or for ongoing health concerns where it might not be medically necessary. But the student union plan is not designed for international students. So it doesn't have that family transportation benefit, right? It doesn't have that repatriation or burial benefit because it is designed primarily for people who are Canadian citizens or permanent residents here in Canada, right? But having MCP, it is an option to have it. So it's important to know that even if you have MCP, you don't have to do the opt-out of the foreign health and switch to the student union plan. You really want to consider what the benefits are and the differences between the two plans. Yes, you can end up gaining benefits, like in terms of that preventative medication and things. The student union health and dental plan is also generally less expensive, but you're also giving up that repatriation, that family transportation. Also, the student union plan is based on you having a valid MCP. And MCP covers you in this province only, unless you're approved and covered for out of province with MCP. So if you're somebody who may be traveling, the foreign health with the GuardMe is going to cover you anywhere in Canada and in some cases outside of the country as well. Okay. So it's important to understand kind of what are the differences of the health insurance. So I've talked a lot. We're covering only our first learning outcome. We've talked about the foreign health with GuardMe, we've talked about MCP, and we've talked about the student union health and dental plan through Green Shield. So now I just want to check in, and we're going to use the chat function here. So just type in once I'm done reading the question if you think this is true or false based on everything we've gone through. All right, so let's get started. Number one, foreign health is mandatory for registered international students. Is that true or false? Yes, so yes means true. Perfect. And that is absolutely right. It is mandatory if you're registered. All right, let's move on to number two. Foreign health only covers you in the province of Newfoundland and Labrador. Is that true or false? So this one is actually false. Foreign health, which is with GuardMe, will cover you anywhere in Canada and can also cover you elsewhere. It's your MCP that is designed to cover you only in this province, although you can get MCP out of province coverage, but it's not implied. You have to apply for that if you have travel. Okay. So number 2 is false. Foreign health will cover you anywhere in Canada and even for some travel internationally. All right. And number 3, you can apply for MCP before you come to Canada. Is this true or false? Yeah, so everybody's got this one. It's false. And the reason is 2 reasons, really. You have to be a resident of this province. So if you haven't moved here yet, you're not a resident yet. And 2, your study permit has to be valid for at least 12 months. And your study permit is not issued till you land in this country, right? Okay, perfect. All right, we're doing all right. So now we're going to move on to kind of the next couple of learning outcomes. And that is about opting out of the foreign health insurance. So the foreign health insurance is mandatory and automatic anytime you are a registered student, right? So when you register, you'll see that charge and that fee on your student account. You will hear, it's opt-out time. And the student unions, they also have opt-outs happening, right? So you'll hear about like the Green Shield opt-outs, the GuardMe opt-outs. And opt-outs really mean kind of canceling your insurance. But there are very, very few cases where you as an international student would be eligible to opt out of the foreign health and cancel that coverage. So the 3 main broad-based categories are: 1, you have MCP and you've chosen to change your coverage from the foreign health to the student union plan. It's really important to understand that MCP by itself is not enough. You will have to, as a registered student at Memorial, pay a fee for a private health insurance, okay? But if you have MCP, you may have the option to choose to switch from the foreign health to the student union plan. So you don't have to do this, but it is an opt-out option. Number 2 is if you're studying outside of Canada. So if you are not intending to come to Memorial in the winter semester because you're taking online courses and you're outside of the country, then you definitely want to opt out because you're really paying for an insurance that's not giving you any benefit. Okay, so you'd be eligible to opt out in that case. And number 3 would be other eligibility. So other eligibility, really, we just have a couple. We don't accept other forms of health insurance, right? With the exception of a couple. One is we have students who are studying through a Libyan scholarship program who have coverage through the Canadian Bureau for International Education. And 2, we have some international students who are studying who are also refugee claimants and are covered under the federal government health plan for refugee claimants. So those individuals can opt out of the foreign health, but having any other kind of alternate insurance wouldn't make you eligible. So for example, if you are a student maybe coming on exchange for Canada and you bought your own insurance from your home country, right? You still have to have the foreign health at Memorial. Okay, so those are the eligibility to opt out. So if you have MCP and you've looked at the GuardMe coverage, you've looked at the Green Shield coverage, and you want to transfer, then you're eligible only if you're a full-time student and you have a valid MCP. And the MCP has to be valid on or before January 1, because again, that's the coverage when your GuardMe would start. So we want to make sure you have other coverage from that date. And you have to have it at least longer than the opt-out period, so past January 20th, and it has to be subject to renewal, okay, which generally it is if you're still a student here, right? Because MCP, even if you have a 4-year study permit, you may only get like a 1-year MCP, and then you got to renew it every year. So that's what we mean by subject to renewal. So if you meet those criteria in the winter, then you can opt out. The challenge is, as a new student, do not expect to meet these eligibility criteria to opt out in the winter, okay? Because most new students might not have an MCP that is valid on or before January 1. So for example, you might not arrive in Canada until later. And so MCP wouldn't go past your arrival date, right? Because that's when you started to be eligible. So it's very common that students in their first semester at least will stay with the foreign health. And you get to determine what that's like, right? And you can compare and gives you time to look at the student union plan. But still, if you're eligible, apply for MCP. So if you're eligible to opt out, then you can do so. And if you're not eligible this winter, the next semester, which is the spring, or the next semester after that, which is the fall, if you're eligible, you'll have another opportunity to opt out. Okay. Now, opt-outs begin once you get an email from GuardMe, and students will start to get those emails next week up until January 20th, depending on when they register for their courses. And once you get that email, it will give you instructions on where you go to opt out, which is online at guard.me/mun, and the deadline is January 20th. So to opt out based on having MCP and transfer to the student union, full-time student MCP valid on or before January 1 and valid beyond January 20th. If you're outside of Canada, then you must opt out before the deadline of January 20th. You go to guard.me/mun once you get your email from GuardMe and you select you want to opt out. This opt out is only going to cancel your coverage for the current semester. If you want to opt out, if you're still outside of Canada, the next semester you're registered in spring or fall, you'd have to opt out again. And then the other eligibility, like we said, is if you're a sponsored student with coverage from under the Libyan Scholarship Program, or you're a refugee claimant with a federal health insurance plan. And those opt-outs are till January 20th. So when you opt out based on MCP or based on these accepted other coverages, then your opt-out is good until the start of our next academic year, which begins in September of every year. Okay, we'll do another quick quiz just to make sure we are meeting our second learning outcome, and our third, which is to understand what the opt-out criteria are and who's eligible. So in the chat, let me know, is this true or false? 1, having MCP is adequate health insurance from the perspective of Memorial. Is that true or false? That's right. This one is actually false, right? So MCP is great coverage, but you will never, as a registered student at Memorial, be able to have just MCP. You must have a private insurance to offset that, okay, which is why you have the foreign health automatically. And if you get MCP, you might be able to switch to the student union plan. So number 1 is false. Number 2, I can opt out of the foreign health insurance in, I should have said February. I didn't update this one. Is that true or false? Knowing that the opt-out deadline is January 20th for the winter semester. So this is false. And number 3, I have insurance for my home country, which means I can opt out of the foreign health. Is this true or false? So it's false. And there's only 3 reasons you can opt out: MCP and transfer to the student union plan, being outside of Canada, and then one of the other small criteria, which is some of our scholarship students or our refugee claimants. Excellent. Okay. So before we move on to talk a bit more about the services you can get through GuardMe, as well as how you can access healthcare, I do want to spend some time to talk about insurance for accompanying dependents or your family members. So we family members really refer to a spouse or a common law partner and or dependent children. Okay, so it wouldn't be like mother, father, brother, sister. It would be a spouse or a child. So if you are coming here to study at Memorial and your family is accompanying you, then you want to make sure that they have health insurance as well, right? Now, Memorial does not make it mandatory for your family members to have insurance. There's really no method for us to be able to do that, right? We have to ensure that you as a student have coverage, and we do that because when you register, we can, make sure you get that charge and enroll you in that plan. But we don't know if you have family coming with you. I mean, I hope you do connect with us. We have a great family advisor and family programming that your family members can avail of. But in terms of being able to set them up on health insurance, we don't know. That would be something that yourself and your family would have to take responsibility for. So your family may be eligible for all or any of the 3 types of health insurance we mentioned, which is the foreign health with GuardMe, the MCP, or the student union plans with Green Shield. Now you can include your dependents on your MCP application. So when you apply for yourself for MCP, you can also include your spouse or your children on that form, but they are only going to be eligible for MCP if you are eligible and they have a valid document for at least the next year as well. Okay, so it happens sometimes that your family will come with you, and if they have a visitor record, or maybe your kids have a study permit, maybe your spouse has a work permit, that should hopefully be valid to the length of your study permit, so you may all be eligible. But it does happen sometimes that the family comes for a short visit, so their immigration document is less than 6 months and they can't get MCP. Okay, so you can include your dependents on your MCP application if you are eligible for MCP and your dependents have a valid status in Canada for at least a year. All right. If you and your dependents, you all get MCP and you decide you want to opt out of the foreign health and switch to the student union plan, well, then you can decide, will you keep MCP only for your family, or do you want to add your dependents to your student union plan? It is possible, but you have to contact your student union to make that purchase and get them coverage. So you're going to pay more than just what's charged to your student account for your family. If you don't opt out of the foreign health, so you stay in GuardMe, you have 10 days from when you get your healthcare access card to be able to add your dependents to your plan and then be able to get them coverage retroactively to January 1. Okay, so what happens with the GuardMe, and we'll talk about this in a minute, is that if you don't opt out and you stay in the plan, your enrollment gets finalized after January 20th, which means that you won't get your healthcare access card until that time, but your coverage still covered you for the whole month of January since the 1st, so it goes retroactive. Anyway, so if you want to add your family to your GuardMe plan, purchase a policy for them essentially, you do it through GuardMe directly, and there is a cost for that. Okay. Sometimes it happens that you as the student gets MCP, but your family, if they arrive later, they don't get a long enough document maybe, or they come for a visit, like I said, then your dependents might not get MCP. Even if you don't have GuardMe, there's still the option if you want to purchase insurance for your family through GuardMe. That is available. Okay. So these are some options. You definitely want to have insurance for your family if they are here in Canada. You don't have to go through these options that are available to you through Memorial. You certainly can look at like travel health insurance from your home country, from another Canadian provider, and buy that. But we strongly recommend that you do, and that you read the coverage and you understand what's covered, right? Even if you're just getting that emergency coverage in case something happens, it's so important. Healthcare in Canada is very expensive. If you were to visit the emergency room because your child fell down and broke their leg, right, you're paying at a minimum 300 Canadian dollars for that visit, right? And that doesn't include, if there are surgical procedures, additional diagnostic testing. An x-ray can cost 150 bucks. I can't even imagine what a PET scan would cost. If you had to be admitted to hospital, I've seen bills that are $3,000 a night. So it is very important to have health insurance. And so you are covered as a student, but your family is not automatically covered, right? And especially if you're traveling with children, it's so important. It's expensive, but it's a lot less expensive than if something were to actually happen. Okay. So as I indicated, if you stay in GuardMe, so you don't opt out, you stay a registered student, you will get another email from GuardMe after the 20th of January with access to your healthcare access card, a copy of your policy. They'll encourage you to make an online account, right? And so you can make an online account with GuardMe where you can submit a claim, you can review your policy. A lot of times, like you'll have your healthcare access card. So you can print it, and if you were to visit the Student Wellness and Counseling Center on campus to see a doctor, they will bill GuardMe directly. And sometimes if you go to a pharmacy and are filling a prescription, you can give your GuardMe card, they can bill GuardMe, but there's a lot of times where they don't do that, depending on the clinic. So sometimes you have to pay for the service that you're getting, and then you go to your GuardMe online account to make a claim. right? And then they reimburse you and pay you back for your service. So that's all done through the GuardMe online account. GuardMe also has a service called Mobile Doctor. Um, and Mobile Doctor is where you can basically book an appointment to speak to a doctor and have a virtual appointment, so over the phone or through video conferencing. And that doctor, in many cases can offer some diagnosis for certain things and can write prescription medications and send them to a local pharmacy for you. Okay. GuardMe also has something called the Student Support Program. Now, you don't need to be in the GuardMe plan to have this, uh, but it is available to students of Memorial, so we'll talk about that. And they also have GuardMe Cares. So this is just kind of a section for the GuardMe website. In your GuardMe account, you can print a healthcare access card, submit your claim, see your policies, download the documents, right? So you can understand what coverage it is you have. There's information there on their website about the mobile doctor, which we talked about, where you can get connected with a physician. Mobile doctor is a great thing to have because you can probably get an appointment, even though it's not in person with the doctor, you can probably get an appointment quite quickly. And in Canada, Canada is certainly facing like a healthcare crisis. You'll see it in the news. There's a lot of people here in Canada who unfortunately don't have a physician that they can visit if they're not feeling well, right? And that can be a real challenge. Fortunately, as a student, you'll have a clinic on campus, so you won't have that problem. But because of the demand, and the fewer number of doctors, sometimes getting in to see a doctor even on campus can take a while. So having this other option to be able to meet with a doctor virtually is fantastic. GuardMe also has this program called Student Support. So student support is about counseling and mental health supports, right? Um, a counselor is not necessarily a medical doctor. And at Memorial, you have the counseling center. So you can again visit a counselor on campus. But there's office hours for those, right? And you have to appointment, but you might be suffering stress or mental health crisis, or just need to talk to somebody about the stress or a situation you're experiencing. And counseling can provide tremendous support there. They're trained to be able to, talk to you and offer real tools that can help you to manage your well-being and your stress. And so as a student at Memorial, even if you don't stay in the GuardMe plan, all students at MUN have access to this program. You can connect with a counselor over the phone, basically 24/7, and in different languages and culturally appropriate counseling. All right, so that's a program. And when you're here at MUN, you might come across some GuardMe ambassadors. We have current students who volunteer and are trained by GuardMe, and they offer different programs and help to run different events on campus. So it's really about building student leaders, and it's a great way for you to get involved, later on in your Memorial career as well. A lot of really good training that they offer. All right. So now we want to test another learning outcome, which is about our access to our GuardMe services. So let me know in the chat, true or false. Number one, to make a claim, I can only do so online. Is that true or false? And this might be something I didn't say, but yeah, you should be doing it online. So I think you can do it by post to make a claim through GuardMe, but online is an option. So this one would be false. And number two, with GuardMe insurance, I can only see a doctor virtually. Is that true or false? So this one is false. Yeah. So GuardMe insurance will still cover you to see a doctor, like I said, and you'll have a campus clinic, and we'll get into that in a minute, where you can see a physician. But in addition to being able to provide coverage for you to see a doctor in person, there is mobile doctor, which can allow you to see a doctor virtually. And number three, I do not need to be enrolled in the GuardMe insurance to avail of the student support program. Is that one true or false? This one is true. So we want to make that distinction. The student support program is the counseling, the wellness program. All students at Memorial have access to that. GuardMe Mobile Doctor, you can only get if you stay in GuardMe. Okay. All right. So we're nearing the end of the presentation, so we'll soon be able to take some questions. But you have insurance, right? You know now about these services that GuardMe offers, but how do you use that insurance? So it's important to have kind of an understanding of the Canadian healthcare system, because no doubt it's different than the healthcare system in your home country, right? In Canada, we have what's called a primary care physician, um, which is essentially if you need to see a medical doctor, you have to first see a primary care physician. You cannot make an appointment in Canada directly with a specialist, right? So a specialist would be a physician who has specialized in a certain area of medicine, like rheumatology, oncology, dermatology, pediatric children specialists, things like that, gastroenterology. Those are all specialist physicians. A primary care physician, on the other hand, is what's often referred to as a general practitioner, or we call most commonly a family doctor. So they don't have that, they have the physician training, they're a medical doctor, but they've not specialized in any one area. So in Canada, your first point of contact in most cases would be to see a family doctor or primary care physician, right? If upon visiting and speaking with that physician, they determine that you do need more specialized care, you would have to be referred to a specialist. And in many cases would have to wait sometimes months and a long time to get that appointment with the specialist if it was needed. Okay. But a primary care physician or family doctor can, of course, treat a lot of different uh, issues, right? But and then refer you to a specialist. Uh, a paramedical really refers to those medical services that are not really perhaps by a physician or a doctor, but they would have some other form of medical training, right? So an eye doctor, an optometrist, or a physiotherapist who would help you, you know, with muscles or rehabilitation, or chiropractor with your bones, even massage therapists, right? Your health insurance typically would cover to some degree these paramedical services. All right, so it's important to understand that difference. Um, there are also other individuals other than a physician, other than a other medical practitioner, that can provide different medical services, and in some cases even prescribe medication. So there's different level of nursing, and you can have like a licensed practical nurse who can provide prescription medications and treat some things. Even our pharmacists can provide some prescriptions for medication, right? So pharmacists are, and they can often provide some diagnosis for some minor health issues. So if you can't get in to see a physician, for example, depending on the nature of your medical concern, you might be able to get an appointment with a nurse who has that extra training, or you can go to the pharmacist and you can speak to them about what medication maybe they might suggest or even prescribed for you. Okay. Now, on campus, you have what's called a Student Wellness and Counseling Center, which is the SWCC. And the Student Wellness and Counseling Center provides all kinds of different supports targeted at your health and well-being. They have physicians on staff, so they have clinics on campus where you would book an appointment and visit a physician. They have nurses on site and nursing services. They will often host various vaccination clinics. You know, as people are getting their flu shots now and over the last couple of months, they host those on campus. And they also have a counseling team. So counselors to provide that mental health and wellness supports. And I believe they even have a medical doctor, a psychiatrist on staff as well. As a student of Memorial, you're kind of doctor's clinic or your family doctor is your student wellness and counseling center, right? So as a student of Memorial, that's your clinic where you can book an appointment, and your family members can do so as well. So your spouse and your dependent children can get services through the student wellness and counseling center. There are external clinics, so clinics outside of the Student Wellness and Counseling Center across the city, where physicians have their own clinics. It is generally not possible to be able to become a patient of those clinics because we have a family doctor shortage here and not many of them accept new patients. So the good news is you don't have to search for your own family doctor. You have one. It's at the Student Wellness and Counseling Center, and you can visit their physicians there. But sometimes it might be hard to get an appointment. You have the mobile doctor, but maybe you want to see a physician in their clinic, like outside of the Student Wellness and Counseling Center. There are some clinics that are open to the general public where you don't have to be normally a patient there. It's like an open walk-in. And NL Health, which is the agency that runs, our healthcare and our hospitals, they have some community care clinics around where you could possibly see a physician there. There is also the emergency department in our hospitals, and there are several hospitals in St. John's. The one that would be closest to us is actually on campus, in fact, is the Health Sciences Center. And in the Health Science, it's the largest hospital in the province. And the reason that it is on campus and right next to us is because our Faculty of Medicine is there, our School of Pharmacy, our Faculty of Nursing, right? Our students train. It's a research and training hospital. So there is an emergency department there. Now, emergency department really is meant for emergencies. You can't wait to see a physician. You need that health care and that treatment now. And it's not a first come, first serve like a lot of walk-in clinics are. It is triage based on need, right? So if a big accident happens, you've been waiting in the emergency department for hours, but those people come in, they get seen first. So the challenge that we're experiencing in Canada is because of the primary care physician, the family doctor shortage, sometimes the emergency department is getting used for reasons that are not its normal intention, right? Because people can't get in to see a primary care physician enough, and sometimes they're very crowded and the wait time can be incredibly long. That's not to say you should avoid the emergency room. If you need it, you need it. It's there, but you want to become aware of the different ways that you can access healthcare so you can advocate for yourself and your health, and you're not left waiting there. It's very depressing in the emergency room. If it's something that well, I can talk to the mobile doctor tomorrow, or I can call those student wellness and counseling, and I can wait till next week, right? Now, I'm not one to be able to give you that advice of, yes, this is emergency, you can wait. And if you are struggling with making that assessment for yourself, there is the health line that you can call. So this is a provincially run health line. It's staffed by nurses, and you can call them at 811 and you can describe the symptoms and things you're experiencing, and they can provide you with advice. Right? I've called the health line many times, and sometimes the advice is, well, you should go to the emergency department. Sometimes the advice is try to get to see your doctor within the next few days, right? And they'll give you that information. All right. Our last quiz to test our last learning outcome, and then we'll get to some questions. So let me know in the chat if this is true or false. Is it easy to get a family doctor outside of the university? True or false? That's right, it's false. Yeah. So you're very fortunate to have the Student Wellness and Counseling Center. It is a fantastic institution at Memorial, one of the many student services available to you as a student, and I hope you get acquainted with them all: the Student Support Office, Career Development, the Internationalization Office, Academic Advising. There's lots there for you as a student. The Student Wellness and Counseling Center is amazing. And number two, I can directly make an appointment with a specialist. Is that true or false? And that is false. Yep. So I understand from a lot of students I meet with that sometimes it's so easy for them to get in to see a specialist in their home country, and when they get to Canada, it's completely different. And that is true. And I think it's important to set up those expectations and understand it's your primary care physician. You advocate for yourself if you think you need to see a specialist, right? And they can make that referral for you. All right. So that brings us to the end of the presentation. Thank you so